All right, ladies and gentlemen, we're going to go ahead and get started. Thank you for joining us today. As always, I like to do a little bit of a sound check before I launch into 45 minutes of just enthralling Medicare information. Could someone give me just a yes or a thumbs up or a high five or something in the chat box just to let me know that you can hear me okay?
I, I can hear you.
Hey, Keith, even better. Thank you very much. Well,
Well,
thanks everybody for joining us. We're going to have a good time today. For those of you that don't know me, my name is Terry. I am one of the founders of Innovative Wealth Building, financial planner, and wealth advisor. You probably know myself, Jen, Warren, Kenna, or some of our other advisors, Coy and Carmen. Thank you so much for taking the time to learn and talk about Medicare. Medicare is one of those really important topics because health insurance is a big expense and a big focus for many of us as we transition to retirement. So we're going to spend some time talking about that today. As always, we appreciate the trust you put in us and allowing us to support your family, and really glad to have you on today's webinar. We're calling this presentation Medicare Made Easy. No matter how many times I say Medicare is easy, I don't even believe it. So my goal is not for you to walk away going, oh, it really is easy, but instead to at least take one, two, three data points away that are going to help you with planning for and really thriving through Medicare and through retirement. So here's our agenda. We're going to cover some of the Medicare basics. We'll talk about different options and choices you have with Medicare. We'll talk a bit about eligibility and how to enroll. And then hopefully I'll also be able to answer some of your questions. I say hopefully because a lot of Medicare is really dependent upon where you live specifically or some factors that could be pretty individual in nature. So if you do have questions, we'll be checking the chat box. But if you can, try to keep them somewhat generic. If there's anything that's too specific that I can't give you the best answer without knowing a lot more, then I will tell you that. And then I will give some next steps towards the end of this presentation so that you can chat with one of us internally or one of our extended Medicare professionals to get you the best information needed for your particular situation. So again, that's our agenda for today. We're going to talk about Medicare Basics, Medicare Options, eligibility, enrollment, frequently asked questions, and then hopefully also give you some insights that are going to be helpful for you in particular. We have a disclaimer. If you met Anne Marie, she's in charge of the disclaimers. So I've got to tell you, Innovative Wealth Building is licensed across the country. We even have some clients out of country. We only provide financial advice in the places where we are authorized to do so. Any of the information that I chat through is not a sales presentation. It's not an offer, a solicitation. It's just education. Any investments, of course, do involve risk. And we never use the word guarantee unless we're really able to guarantee things, which is not that often. Lastly, this is generic in nature. So for your particular situation, don't take anything I say as a hard recommendation. Instead, talk to your qualified professional to find the path that's best for you, your family, and those you care about. So we're going to just start with the basics. Whether you're retired or not, you probably have some health coverage. While you're working, your health coverage really should be all-encompassing. So you have that health insurance coverage. It should provide pretty much anything. So we want to think of that as a completed house. Now, unfortunately, the way Medicare works, it's not just one piece that covers everything. No, the government had to go and make it a little bit more fun and a little bit more complex. So we're going to talk about the different pieces of the Medicare puzzle. First, we're going to talk about standard or traditional Medicare. Later, we'll talk about Medicare Advantage. That's what I would call non-standard. But again, standard is the most basic form of Medicare. It's kind of the default package. So this is how it works. It is broken up into many different components. Medicare has Part A, B, C, and D. So let's start with Part A. Part A is your hospital coverage. This is literally the part of your insurance through Medicare that covers you going to a facility and having some of the services within that facility. Now, Part A, for most people, is free. There's no cost for Medicare Part A. Medicare Part A and B can be claimed at different times, and that's an important factor because if you don't need to claim B and pay for it, then some people will choose to claim A and then just take B later. B is medical coverage. Once you're in the facility, there may be different types of professionals providing certain types of services, and that's covered by a different part of Medicare. So again, the whole goal is for all the different parts to work together to give you protection. Part A is for while you're in the facility, covers you being there. Part B is the things that happen within the facility. At some point, you might need medication. That's where Part D comes in. That's your prescriptions and your medication, which nowadays Medicare Part D is included in the price of Part B. So your basic package, the basic Medicare, is at least A, B, and D. With that said, those three together aren't going to cover everything. In fact, people will say that Medicare has what you call a donut hole. You've all seen a donut. It's got that ring of crispy deliciousness, maybe with sprinkles and like frosting on it, but then there's that hole in the middle. Medicare is the same way. If you just have Medicare Part A, B, and D, you might be on the hook for some substantial expenses. So, in order to fill that hole, people will also buy Medicare supplements, also known as Medigap policies, to fill the donut hole. So, if you want a comprehensive, standard, traditional Medicare package that covers pretty much everything, that means you're going to need Part A, B, D, and then the special sauce, which is the Medigap or supplemental policy. So that's kind of step one. If you want to be fully covered and you don't have other benefits like military, federal employee, or other health benefits, this is your basic package, Medicare Part A, B, D, plus Medigap. I know we're starting out really, really simple because, again, Medicare is so easy. But I wanted to just start there because that's the basic components of how Medicare works. So let's talk a little bit further. We said that the first list, ABD plus, is your standard. Medicare Part C is also known as Medicare Advantage. I say it's not standard because the goal of Medicare Advantage is to give you all the basic stuff in A, B, and D, but then to throw on additional things. So some Medicare Advantage policies will give you free shoes once a year. Some come with gym memberships. The point of Medicare Part C is to hopefully give you additional benefits and services without giving you much additional cost. It also has some different ways to share the cost. So paying certain dollar amounts for certain things versus paying percentages of bills. There's some nuances where you really have to consider what do you want out of your retirement to make the best selection. That said, Medicare Part C does have some limitations depending on how much you plan to travel in retirement, how much access you want to all the doctors. Again, you're going to have to weigh the pros and cons of the standard versus a non-standard option. So again, with Medicare Part C, you are getting a lot of the basic things, but you're also going to get some of the additional things thrown in. Dental care, vision care, maybe a fitness program, a gym membership, certain drugs. Again, you have those two big choices. They're supposed to do functionally the same thing for you, but the way that they go about doing it is really, really different. The last thing to know, Medicare Part C is basically when private companies come in and try to do the same job as the government, but better. And again, they want to do it for you at a lower price. So when you're signing up for Medicare, you have all these choices available. Really important to understand what the choices are, what the doctors are that you want to see, the specific types of medications you're on, and other factors to make sure you make the best decision. So when did Medicare Advantage start? It started back in 2003. Really, Medicare had been around for a long time and it covers millions of people, but they were just looking for another opportunity. Sometimes people will say that the government is not that efficient as far as how it uses resources and provides services. So private companies decided to give it their best shot to, again, give you all the things that you're supposed to have, but to do it at a lower cost or maybe even give you some additional benefits. So Medicare Part C can sometimes have low or no additional cost out of pocket. It's also going to give you co-payments and co-insurance, which can help you control your medical cost. So let's look at a couple examples. Again, Medicare Part C is going to also give you all the A and B and D stuff put together. And if you just look to the right side of the screen, think about going to see the doctor. If you don't have robust insurance, going to see the doctor could be quite an expensive affair. But if your copay is only $0 to $10 to see the doctor, maybe that's not that scary. Sometimes we need to see a specialist. Well, with some Medicare Advantage or Part C plans, that's just 25 to 50 bucks. Again, not too bad of a thing. So there's pros and cons, again, between the standard package or the non-standard, which is Medicare Advantage. But you've got to weigh the cost, the benefits, the flexibility, the not flexibility, so that you can figure out which one is best for you. I'm going to pause there for a second. And again, I'll just remind you, if there's any questions you have, please let me know. If it's something I can answer that doesn't go too specific, and I say that again because it's based off regions and where you live and other factors. But if you have questions, I'll be checking the chat box and then we'll kind of go from there. Again, whether the standard package or not standard is best for you really depends. As you think about your retirement, think about the level of risk you're willing to take. With investments, we have people that are really aggressive and they want high returns, high risk. We have people that are conservative. They are willing to take lower returns if they can take lower risk. When it comes to your healthcare, are you high risk or low risk? The lower you want your risk to be, the more you may have to pay out of pocket to keep yourself safe from having those unexpected big medical bills. So again, you've possibly never thought of risk tolerance as it relates to medical decisions, but that is a way to think about it as you get ready for Medicare. Some people just pay whatever is needed to get the best supplements, the best coverage, so that whatever happens in the future, they're able to mitigate some of those costs. So there's a question. The question was, would TRICARE for Life be the Medigap? That's a good question. So TRICARE can form or it can serve almost as a Medigap replacement. So yes, if you do have Medicare Part A and B, and then you have TRICARE for Life, you very well may not need any supplements or any Medigap policies at all. So correct. And that's the same nuance with some of the federal benefits and the other health benefits that exist. Again, depends on your situation, depends on if there's any additional things you want to be protected against, but you're absolutely right. TRICARE for Life could form almost as a Medigap or Medicare supplement alternative. You mentioned Part B can be put off. Is there a penalty for waiting for Part B? 100%. So if you wait too long to sign up for Medicare Part B, there is a 10% penalty for life. The baseline cost of Medicare Part B is $175 per month per person. If you wait too long to sign up, there's a 10% penalty. So you could pay an extra $17 a month forever. Now, that's per spouse. And oh, by the way, for every year you wait too long, that 10% compounds and they just add it on top, add it on top. So yes, claiming Medicare too late can be a really, really bad thing because they will literally penalize you for life. I didn't even believe it the first time I studied that and read it, but it's a real thing. It's a lifetime penalty. So you want to make sure you know the rules so you sign up on time for Medicare Part B. Part A, the rules for when you sign up are the same as B. I'll talk about that a little bit later in the presentation. Part A is typically free, so you don't worry about that one quite as much, but in any situation, you do want to sign up on time. Great question. So again, we want your health insurance, i.e. Medicare, to cover the whole house. The way that it really ends up working out is your Part A and Part B, that's kind of your foundation. Your Part D, your other things that forms the walls, And then to really put the roof on and protect everything, you have the Part C, which is Medicare Advantage. You have the TRICARE for Life. You have the Medigap or other supplements. Again, when you put all these things together, hopefully we're protected on all ends. And we're protected against, all the things we can be protected from. I was going to give an analogy, but, I could already tell it wasn't going to be very good. So, we're just going to skip that analogy. All right, so let's talk about Medicare eligibility. To be eligible for Medicare, it comes down to three basic tests. Maybe there's another test out there, but these are the three most basic ones that apply 99% of the time. Number one is age. Age 65 is the magic number. If you're that age or you're getting close to that age, you've probably realized that because you might have started already getting a bunch of mail related to turning 65. So 3 months before your 65th birthday, that's when you first enter eligibility. The month you turn 65 is another window, and then the 3 months thereafter. So turning 65, that's the first level of eligibility. Number two, married. If you're married and you've never worked outside of the home, but your spouse qualifies for Medicare, you do as well. You're able to qualify based off your spouse's earning history. Now, you very well could qualify for Medicare based off your own earning history. The general rule is about 10 years of full-time work is what's required for you to be able to get a Medicare benefit without having to make an additional payment for Medicare Part A. The last letter is D, that's for disabled. If you have certain types of disabilities, heart failure, things of that nature, you may be able to get on Medicare before age 65. So just, again, those are the three rules with figuring out when you're going to be eligible to sign up for Medicare. Age 65, married to someone who is qualified, or unfortunately disabled. So there was a question, can you have a Medigap supplement and Medicare Advantage? Great question. You're only able to get the Medigap or the supplements, I believe, if you're doing the traditional plan. So typically the Medicare Advantage is going to plug some of those holes that we're going to talk about in a little bit. So really the Medigap and the supplements are more so meant for the standard or traditional program where you have the ABD and then you plus. The Medicare C is really supposed to control some of those deductibles and co-pays and co-insurances. So really Medicare Advantage should be like a standalone that does everything, where the standard plan is you put all these 5 pieces or 4 pieces together to kind of get the same thing. Great question. And we're going to see some examples of that in just a few slides. All right, so enrollment is pretty easy. The easiest way you can enroll is when you're of age, go to ssa.gov, that's Social Security Administration.gov, and then you can sign up for Part A and B. It maybe takes you 5 minutes to do the digital application. You can also call. We have the phone number listed. It's really, really small, so I would just Google it, or we can send you the slides. Or if you decide to take Social Security before 65, then you may get automatically enrolled in Medicare once you're of age. So online, via phone, or automatic enrollment can happen if you claim Social Security prior till 65, which of course is prior to full retirement age for anyone who hasn't already claimed Social Security. Your initial enrollment period is that first opportunity to sign up for Medicare. During this time frame, you are guaranteed to be able to have many choices available to you. This is often when you first turn 65 or the first time you're eligible to enroll based off of no longer having qualified coverage through your employer. So open enrollment is another good time to be aware of. This is starting in a couple weeks. And every year, this is your opportunity to make adjustments, to go from Medicare Standard to Advantage, back and forth, to choose different supplements or different plans. During open enrollment, you're able to make some adjustments. Outside of open enrollment, you may have to wait unless you have a special enrollment period. The special enrollment period is based off of something happening. There could be a loss of coverage through work. There could be a weather event, like unfortunately the one we had recently, or a pandemic, or moving to a different area. There's certain things that cause you to be able to have a special enrollment period where you no longer have to wait until open enrollment. Think of it almost as when you have a child. When you have a child, typically your employer allows you to change your benefits because you now have a life event where you may have to make some adjustments. For Medicare, it's the same way. Under certain circumstances, you may not have to wait all the way until open enrollment. You might be able to make some changes earlier. Great question. If I have no adjustments, do I have to do something during open enrollment to continue coverage? No, you shouldn't have to do anything. It should just continue to renew. To be double safe, I would just check to make sure that the things from last year are still showing up so you don't have any types of gaps, but it should just auto renew and kind of roll forward. Oops, sorry. I put the chat box in the way of the whole screen. So as I mentioned, open enrollment is a good time to make adjustments. If you need to switch from one plan to the next, if you need to enroll in something, you can do so. As the slide says, unfortunately, just like Part B, if you sign up for Part D later, you could have a penalty. I recently spoke with someone, they were in their 80s and they never had Medicare Part D. And she said, "Hey, Terry, should I sign up for Medicare Part D?" Unfortunately, they base the penalty on the number of months since you should have signed up. She's in her 80s. We did the math, and the additional amount of money she would be paying just towards premiums was less than the out-of-pocket she's paying for the drugs anyways. So in that situation, she didn't sign up for Medicare Part D because unfortunately she had missed it 15, 20 years ago, and the penalty now that she would be paying is pretty high. Now, Medicare Part D penalties and premiums are much lower than Part B, but nonetheless, it can still add up to be a pretty substantial number. So how much does Medicare cost? I was thinking about quizzing the crowd, but I think I answered this question earlier. Often people think Medicare is free. It feels free, I guess, because most people pay Medicare directly from their Social Security. That's something the government got right. They said, hey, if we want our money, we'll take it off the top before you get your Social Security check. So at the lowest, Medicare cost about $175 per month per person. So technically $174.70. Nowadays, the Medicare Part D, the drug coverage is just included as a part of the Part B premium. That wasn't always the case. So what you have to be aware of are these income brackets. If you're single or you're married and filing separately, the magic number is 103,000. As long as your income's below 103,000, this is what you pay for Medicare, $175. And they look back 2 years to dictate what you pay now. For married folks, the number is 206,000. These numbers are really important. If you go over these brackets by even $1, then you're going to see your Medicare premiums get hiked. You're going to end up paying more for Medicare and getting the exact same thing as everybody else. That is 100% sunk cost, aka something we don't want to happen. So this is based off of 2 years ago, your MAGI, also known as your modified adjusted gross income. It's basically your adjusted gross income, which most of us don't know how to calculate that because taxes are hard. But what you really need to know is they add back in things that you were able to deduct otherwise for taxes. One of the sneaky things that they add back in is tax-free interest from bonds. So let's say part of your retirement income plan is to have tax-free income from government bonds. Well, Medicare doesn't like that too much. So they take that tax-free interest, add it back into the calculation. And again, if that pushes you over their threshold by even $1, congratulations, you pay more for Medicare. So how much more do I have to pay if I go over by $1? I'm glad you asked, and it's on the slide. If you go over by $1, so single, $103,001, or $206,001 for married and joint, your premium goes up to $244.60. plus you pay $12.90 for Medicare Part D. The bottom line is it costs you an extra $82.80 per month per person. So for a couple, by just going over the brackets by $1 could cost you an extra $2,000 per year. This isn't to scare you, but this is just to let you know if you're in a fortunate enough situation where your income, your investments, your rental properties are going to be giving you substantial income to where you could be near these brackets, you may need to engage in some proactive tax planning because the last thing you want to do is to go over by $1 and end up paying an extra $2,000 in additional premiums where you get no bang for your buck. Keep in mind, Roth conversions, some of the taxes from your investment portfolios that are not retirement, these things all add together to get you to that magic number. So you want to be very careful to ensure you don't accidentally go over. It is not fun paying extra money and getting nothing better as far as the type of coverage that you get. I'll go through a couple more slides with the price, and then there's another question. So here's the big chart. I don't know about you, but it makes my head hurt to look at this chart. So sorry in advance. But the thing to just realize is if you're in a situation where your income was really, really, really high, 500,000, 750,000, you're paying almost $600 per month per person plus the $81 for Part D. So let's say you're a business owner. You sell your business, there's this big event and a bunch of money that ends up on your tax return. You could be in line to pay tens of thousands of dollars extra for Medicare for 1 year or maybe even more. So, that's kind of a tough pill to swallow. So again, there are several levels to this, and it's all based off of income. So just be proactive with knowing where your income will fall. So first question, do the penalties start at first sign up or time of eligibility? The penalties will start at sign up. So if you don't sign up for Part B or D, they won't penalize you. But if you do sign up later, that's when they will penalize you. So they won't retro and say, hey, you got to back pay us, back penalty. They'll just add the penalty on top going forward. So they're at least nice about that. Is the cost updated after retirement? Thinking income levels will go down and premium should correct. John, that's a great question. So here's what happens. Medicare doesn't care. All they're looking at is your modified adjusted gross income from 2 years ago. Then they're going to assign you whatever price they think you should pay. You got two choices. Pay it, or if you don't think it's fair, then you can fight them on it. You can appeal their decision and say, I don't want to pay that. I'm glad you asked that question because we come across people that are paying too much for Medicare. Their life is different. They've had a situation change. There's no reason they should be penalized and paying based off of 2 years ago. There's something called the Form SSA 44, Medicare Income Related Monthly Adjustment Amount Life-Changing Event Form, basically IRMA, which is how they calculate how much you're paying in premiums. You fill out this form, you submit it, and if you win, they will back pay you all the money you overpaid, and they will adjust your premiums down going forward. We've had this done several times with our clients. It's the real deal. So they will 100% overcharge you based off of data 2 years ago. And the only way you can get them to appeal that and possibly reduce what you're getting charged is to fill out the SSA 44 form, to submit it, and then maybe pray or cross your fingers or, do something lucky and then wait for them to get back to you. So great question. We've seen this happen many, many times. We've seen some get approved. We've seen some not get approved. Unfortunately, if you retired, they may even need documentation from your former employer to just certify you're no longer working, your income's different. There's certain hoops that you may have to go through, but if it saves you hundreds or thousands of dollars, again, the SSA 44 form, I would say would be time well spent. So let's now look at an example of how Medicare works. Again, I told you there's all these holes, there's all these parts. Let's look at a real life example. And the words might be a little bit small, so I'll just describe what it is. So you're being hospitalized. So your Part A of your Medicare is going to kick in. This covers inpatient hospital, skilled nursing, home health, or hospice. And let's say you need those services. Well, unfortunately, there's a deductible. The first $1,632 per period of coverage is out of your pocket. There's also a copay. So if you're in the hospital beyond 60 days, you then start paying $408 a day. Then if you're in the hospital 91 days plus, there's even more money you pay. So again, the Part A covers some stuff, but the deductible and then the co-pays or the co-insurance, some of that falls to you. Again, for skilled nursing, there's also some fees. So now we'll talk about the Part B. This covers the doctors and the medical services. So outpatient services, doctors, specialists, preventive care, etc. Again, they don't cover 100%, so maybe 20% of the bill's on you. There could be excess charges beyond what they're willing to cover anyways. And when you think about the stuff that's not covered in Part A and the stuff that's not covered in Part B, it might be enough to sink the ship. Not everyone has thousands of dollars laying around to pay unexpected medical bills. So again, that's where these Medigap policies or these supplements come into place. That's why the TRICARES for Life or the Federal Employee Health Benefits or other things are helpful because we know Medicare has gaps. We know there's holes in the ship. So by plugging those holes, you control the out-of-pocket cost. This isn't new. Medigap and these supplemental policies have been around since 1966. Currently, there are 10 plans available. And again, that's what makes it complicated. You've got to think about the 10 different plans, the 10 different costs, your situation, and see what you want to do. Ultimately, it's to fill the gaps, it's to plug the holes, and you pay a monthly premium in exchange for protection from having to incur those costs later. So there's many plans available. There's different nuances. Unfortunately, the good plans sometimes go away, then you can't get them anymore. But I wanted to show you one example of Medicare Plan G, where it covers some of the co-insurance, it covers the co-payment, it covers the first 3 pints of blood, which you would think would be covered, but they are not. It covers the deductible and 80% of foreign travel emergencies. So earlier we looked at that boat with all those holes. Well, if someone had this Medigap policy, instead of these holes existing, these holes are plugged. You're saving $1,600, $400, $800, $200, 20% of a physician's bill, which I don't know the last time you got a physician's bill, but they can be pretty expensive. So by having these Medigap policies or supplements, you probably end up being happy. Again, it's a trade-off. You're trading paying a monthly cost sometimes in order to not have these big costs later. And that's the magic. So do you want to pay as little as possible every month and just know there could be big costs later? Or would you rather just pay that consistent, slightly higher amount, but know that you're more so protected in the event that something happens and there could be big costs down the road? Yeah, very cheesy, right? How we go from this to this. I don't know if you're following the animation. Looks like a different person to me, but we'll just move along. So again, we talked about Medicare Advantage, and there was a question. Could you have Medicare Advantage and supplements? No, not really, because the supplements are meant to fill the gaps, just like Medicare Advantage is meant to give you the basics and then also fill the gaps. So there's some different nuances from state to state. There's private Medicare Advantage plans through employers sometimes. Medicare Advantage in general might save you money versus supplements. But again, there's some trade-offs. Some require underwriting where you have to prove insurability. Some don't. Some plans, you can only go to certain people that accept it. Other plans, you can go anywhere. So you've got to weigh the pros and cons, the flexibility, the cost, the savings, the extra benefits, and that will help you make an informed decision. So as we get ready to wrap up, I have some frequently asked questions. We may have touched on these a little bit, but I do want to just make sure I hit some of these again. And the first question is, do I need Medicare if I have other insurance? Maybe. So as long as you're covered at work and you're actively working, you don't have to sign up for Medicare. Whatever your age is, you don't really have to sign up. Unless you work at a small employer that has less than 20 employees. If your employer has less than 20 employees, you are supposed to sign up for Medicare at 65. Medicare is supposed to become your primary at 65. Any other insurance becomes your backup. Now, if you work at a company with more than 21 employees, your company's coverage is still the primary, and then Medicare would become the backup, or you don't have to sign up for it at all. So do I need Medicare if I have other insurances? Maybe not. But if you're getting close to 65, just make sure you feel good about not signing up for it so you don't accidentally have penalties later. So what if I have employer provided coverage? I think we just mentioned that. Um, Even if you're retired and your employer or former employer gives you insurance coverage, you may still want to sign up for Medicare. Medicare might fill some of the gaps in that protection. And unfortunately, if you don't get Medicare when you're supposed to, as I mentioned, there could be some lifetime penalties. So you just want to make sure you fully understand how the coverage works now and how it'll work into the future. Again, 65 is kind of the magic age to ask those questions and make sure you feel really good about it. Do I have to sign up for Medicare at 65? No, you don't. So you got the first 3 months before your birthday, 3 months after, and then you have up to 8 months from when you no longer are covered at work. So you retire at 68, yeah, 8 months to get Medicare and not have that penalty. I wouldn't suggest waiting that long. Sometimes there's reasons to delay because based off of where you are in the calendar year, the 2-year look back, maybe doing the health insurance marketplace because your income's low. There's some ways you can finesse the system to save money. But again, you just want to be careful. How are Medicare premiums calculated? We talked about that. That's based off of your IRMA, basically your modified adjusted gross income. They add back in some preference items such as tax-free interest. And then there's 5 or 6 levels. Don't go over by a single dollar or you get to pay at that new age band, or excuse me, the new price band. What if I missed my sign up window? Hopefully, it's not too late. If it is too late, it's an additional 10% penalty per year for Part B, and that lasts forever. For Part D, it's number of months times 1% of the Part D premium, and that's what the penalty cost is. So again, it's per month or per year for them to decide the additional penalty if you sign up too late. Why do I have to pay for Medicare Part A? So let's say a person's single and they haven't worked in the United States for enough quarters. Again, it's roughly 10 years of full-time work, earning about $1,800 a quarter. But if you haven't done that, you may have to pay for Medicare Part A because you just don't have enough work credits for it to become free. So that doesn't happen that often, but it does happen sometimes. That's one of the important nuances about being married versus being in a partnership where you're not married. If you're married, then you automatically get Medicare based off of your spouse. You also have those spousal benefits for Social Security. If you're not married, there's no benefits. So sometimes people will ask me as they're getting closer to retirement, hey, should we be married? Maybe, because the tax laws do actually have some favor towards marriage, depending on your situation. And specifically, married filing joint, married filing separate doesn't work out in many situations in retirement. The rules are different in retirement versus not. So again, taxes are one of the big expenses you'll face forever. So just make sure you feel good about that as you get ready to transition to retirement. Lastly, does my spouse automatically qualify for Medicare benefits? I guess I kind of got the cart in front of the horse on that one. They probably do if you're married. So they're able to qualify based off of your work history or your spouse's work history. So I heard once that the end of every journey is the beginning of a new journey. Every year is this fun new journey of open enrollment and Medicare and all this fun stuff. Um, we just hope that some of the things you've learned so far have helped you on the journey to get to where you are, and that the things we're talking about and the things you'll continue to investigate will help get you to that next level, and so on and so on. The next steps that I would suggest, if you haven't already, is to just create your retirement vision. What I mean by that is to really think about, like, in a perfect year one of retirement, what does that look like to you? Is it traveling a bunch? Is it being near the grandkids? Is it, going to 20 water parks? Like, traveling all over the world, because some of those things are going to matter when you make your Medicare decisions. So most people don't have a clear picture or vision of what they want their ideal retirement to look like. So that would be one thing that I would suggest. Another thing I would suggest would be just to chat with your advisor. Of course, this isn't the best opportunity to talk the specifics of your situation, but if you have TRICARE for life, or you have the federal employee health benefits, or you worked at Boeing and they are offering you certain type of healthcare coverage forever through Medicare Advantage, a preferred plan, you want to bring that to your advisor and then just make sure you're tracking and you're feeling good about the decisions you're going to make going forward for the rest of your healthcare needs. Learn more about Medicare. There's a bunch of resources out there, from the Social Security website to the CMS.gov website. There's a lot to be learned. And the last part that I would mention is you don't necessarily have to learn it all yourself. Your advisor can help, but then we also contract with a company where we can get you a complimentary one-on-one conversation with a Medicare professional to hear more about you, to look at your list of medications, to talk about your particular situation, and help give you some guidance on Medicare Standard versus Medicare Advantage, on the 10 supplemental policies, and then also give you real pricing so that you can start to build that picture of what you'd like to accomplish, the level of risk you want to take off the table in retirement, and then also so you can know what the cost is going to be. So all those things are super important. And then also lastly, again, I always tie it back to 2 years ago, what was your income? Look at that income chart for modified adjusted gross income so you can know what you're going to be paying. And if needed, you can fill out the form to eliminate that surcharge or the extra payment that you have towards Medicare premiums. So again, that's the SSA 44 form. We pass those things out like hotcakes because often we see people that are overpaying for Medicare based off of data that's 2 years old. So those are the next steps that I would suggest. And that is my last slide. I always aim for 45 minutes and I never end on time. This is a first ever. So are there any other questions that I can answer tonight before I let you get back to enjoying your day? While I wait for the chat box, I'm going to go ahead and pull up my last slide. I always like to end with the same way that I begin, which is just to say thank you. If it weren't for you all showing up to be part of this conversation, I would have just been talking to myself for the last hour, and that gets a little awkward. I don't want the neighbors thinking too many weird things. So thank you all for being here with me. So I'm not just here talking to myself. So John, I did not say where you could find a Medicare Pro. We have one in-house through a partnership. So talk to your advisor and they can book you on their calendars. We actually have 3. Also, you might have some in the county. I know one in the DC area. Jen and Warren, or our other advisors, Coy, they may know one in St. Mary's or other locations. But I'd say just chat with your advisor. Yep, and your advisor has a link to be able to directly schedule a meeting. And you can have the meeting by yourself, or if your advisor is available, they can be on the meeting with you to just help with the conversation and to make sure it's nice and smooth and easy. So again, all the advisors have the link. We can just directly schedule based off of whenever is convenient for you on the person's calendar. Any other questions? Does the payment chart update every year? Absolutely. It keeps going up. So later this year, we'll see what the prices will be for 2025. They made that funny change where Part B and Part D used to be separate, and then they kind of lumped them together, which was really interesting. So yes, every year, typically at a greater pace than inflation, the Medicare costs will keep going up. Great question. Sorry, not a great answer, but that is the answer. All right, any other questions? You're welcome. Thanks for being here, Barb. Next time I'm going to call on you. I should have looked at the list of who was here. Well, as always, thank you all for tuning in. If there's any other webinar topics you want to hear about, I'm going to turn off the screen, but you can type it in the chat box. You can also just email your advisor, or I'll put in the chat box our inbox, which is yourteam@teamiwb.com. if there's other things you want us to talk about, please let us know. We think we know some things to talk about that are helpful, but we are more interested in whatever you want to hear about. So ignore my first attempt at typing. Again, it's your team at teamiwb.com. If there's other topics you want to hear about, just let us know. And we're going to get going with a lot more content. So thanks everybody for joining. Thanks, Mom, for saying thank you, Terry. That's weird. You usually don't call me by my first name, but again, thanks everybody. I'm going to turn off the camera now. Please leave any more comments or questions, and we'll follow up. And then also, if there's any topics you want to hear about, just let us know. Appreciate your time. Have a great night, and we'll talk to you again soon.